Hello, my name is Angelina D'Ancheco, and I'm going to be discussing 3 topics I learned in our interprofessional communications course, as well as a movie that um, had a topic as well that was discussed in our course. The first topic I would like to talk about is generalization versus stereotype. Generalizations was described in our course as common trends and beliefs and behaviors. However, generalizations can become stereotypes when those common trends in beliefs and behaviors are applied to specific individuals. I felt that it's important to recognize the differences between these 2 topics because as healthcare individuals, we can become vulnerable within a certain situation in the clinic, and it's important to just know the distinguishing factors between generalization and stereotypes. On the other hand, I thought that generalizations could be beneficial within the clinic because it can help us be aware of a person's needs within their culture. However, if you apply a stereotype to a client, it can hinder the type of care that is provided to the client. My next topic I would like to discuss is CUS. CUS stands for Concern, Uncomfortable, and Safety. I felt that this is a very important topic, and I can't wait to use within summer field work. Prior scenarios where I volunteered, I wasn't quite sure how to assess the situation if I wasn't feeling very comfortable with what was going on within the session, just because I didn't want to overstep my boundaries since the person I was observing had seniority. I felt like it's a very helpful tool, and it will be able to help widen my knowledge within the clinic if there is something I'm not sure about, and they can further explain it to me. And like I said before, I'll be using it in fieldwork hopefully this summer. The next topic I would like to discuss is the SBAR, Situation, Background, Assessment, Recommendation, or Request. This communication tool will be very effective in the hospital clinical setting or rehab setting as well. I learned that this strategy is important when relaying critical information about a patient's condition, and it also helps keep all of the team members on the same page, and it's an effective tool to keep patient safety a top priority. Without proper communication and an SBAR, it's very difficult to provide proper care to your patient because not everyone's going to be on the same page, and when handing off to a new care provider within the hospital, they need to be completely aware of what is going on with the patient's current status, and using this is great to just give them the situation on the patient, background history on the patient, an assessment, and then a recommendation or a request on what the next care provider should be doing, or if you're making a request, what you need from that person you're having a conversation with. And my last topic I would like to discuss is how this is related to a movie. I picked Toy Story. And throughout Toy Story, there are really great communication skills between all of the characters in the movie. Woody is the main character in Toy Story 1, as well as Buzz Lightyear. Woody generally takes control of the whole meetings he puts together for all the toys, and as well, there's great communication between all of the toys because they are alive and acting and real. However, Andy is not aware of this, and Andy is their caretaker, you could say. He plays with all of those toys, and there's always great communication, and everyone's aware of the situation. As well, I did notice some different cultural background between Buzz and Woody in the movie. Woody is an older toy, and Buzz is the new hit toy within the movie. And at the very beginning, well, in the beginning movie, there was kind of some hostility between Buzz and Woody because Woody was not sure of this new toy and comes from a new culture, and felt that he might overtake his position as being Andy's favorite toy. However, in the movie, they learn to get along, and communication is always implemented throughout the whole movie. And that displayed a little bit of cultural background in Andy being an old toy and Buzz being a new toy, and then being from different types of backgrounds. Woody being a cowboy and Buzz being a space toy. And that's my video. Thank you.